I see lots of techniques on Instagram, which it's almost like they're maximizing the number of bruises you could have by going through the lip as many times as possible.
So what affects the size of a bruise?
So the size of the bruise and the frequency of bruising is affected by lots of different factors. It's really important to break them down because once you understand the factors, you get to try and exert some control over each factor. So for example, talking about the hot weather as we started, which would be a problem for many practitioners, doesn't know where you're on the world, you're probably going to have days where it's hotter than other days. That's going to increase the amount of blood flow in the skin because your skin is an organ that keeps the body cool. So one of the things that happens in hot days is you dilate veins and there's more blood flow literally going through the skin. So there's more blood to leak out. There are more dilated vessels to be punctured by your needle, and you're more likely to get bruising. So that might just be one factor, which is the temperature. What can you do to control the temperature? The amount of blood flow going through the skin is also affected by cardiac output. So if your patient is nervous, their heart might be pumping faster, you might get more bruising. The type of medication that they're on might affect the rate of clotting. So rate of clotting is another thing we can have some control over, or at least respond to a delayed rate of clotting. For example, if you're treating someone who you know is taking aspirin and you see a little bleed when you pull the needle out, hold it for longer than you would for your other patients, and that will decrease the amount of bruising. So this is the systematic way that you can go through the factors that cause bruising and adjust for it. Size of the hole caused by the instrument that you puncture. So the size of the vessel will affect how much blood flow through the leaking hole. So that all comes down to your anatomy and looking for visible veins. You could also change the size of the needle that you're using. Inject more gently if you're using a cannula, because all of these things might affect the size of the hole made with the instrument when you're injecting. The number of holes, this is a really easy way to reduce bruising, and there are many techniques. I see lots of techniques on Instagram, which it's almost like they're maximizing the number of bruises you could have by going through the lip as many times as possible.